The next thing we're going to be going over in your cervical care kit is going to be your neck trigger point device. The way that we're going to be doing this is going to be addressing musculature in the posterior and sides of your neck. The reason this is important is we're going to work in 3 different sections. It's going to be from lower, middle, and upper neck. The way we're going to do that is we're going to use the balls on this device to squeeze on the back of the neck and side of the neck and use it as an anchor point. You find your trigger point, you lock it down, and then you stretch from side to side. The way we describe to do it is to move up 2 segments each time. And what that looks like is about an inch each time up the neck. So you'll go lower neck, stretch side to side, middle of the neck, stretching side to side, and then upper neck at the base of the skull. This will be a tender area, but you squeeze the pressure that you are comfortable with and stretch there as well. The way it works as an anchor point is you're stretching from here and above as you move from side to side. This is important for us for multiple reasons. One way we would describe for you to use this would be before you get on your cervical dinner roll, so that you can loosen up the trigger points and the musculature so that you can get in more easy and comfortable stretch. The other thing that it helps for us as well is if you loosen up those trigger points and adhesions, it makes it easier for us to move the segments necessary.
Next, we've got the lacrosse ball that's going to be used for breaking up adhesions and scar tissue in the musculature of the upper body in particular. You can use it for the lower body, but it's going to be more effective, especially through the pecs, the shoulders, and then the rhomboids in your back. So first, what you're going to want to do with this, you can use it to massage, just nice and easy. That's not really necessarily what we're going to want you to use it for. We're going to want to use it more for, especially up against a wall. If you can push into the wall here, you're going to want to kind of be around a corner usually when you do this, so that way your face isn't directly into the wall. But when you push in with the ball, get that spot in particular, then there's a couple different ways we can do this. You can move around against the wall, pushing in, so you can get more force in there to help break up those adhesions and scar tissue that have formed in there, really help open up the pec. So going back and forth through here at an angle, as well as not just moving your body against the wall, but having it stationary and then lifting your arm up and down, more out to get a wider angle. You can also, when you're around a corner, you can have it here, which will tighten the pec, and then bring it out to get a nice stretch. You'll feel that get very deep in there. And then for the back, what we can do is for the rhomboids in particular is, so through here between the shoulder blade or the scapula and the spine, you don't want to do this over the bone at all, but if you place the ball here, and one little trick that you can do in order to reach this easier is if you put this in a long sock and then you kind of sling it over so you can maneuver it around a little bit easier, not have to worry so much about placement. But when you get it in there, then going back and forth through here against the wall. Now, will you bring your arm across your chest for me, please? So when you pull that out, that creates a significantly larger space here, which then you can roll much further back and forth through these muscles and actually get significantly deeper as well. Thank you. Then from there, another thing that we also want you to do to really focus on stretching the musculature in the neck is going to be tilting the head back, pulling down slightly on the collarbones. When you do this, make sure that you hold the chin up, kind of like you're closing your mouth, but also going up towards the ceiling, which is going to really get a deeper stretch through here. Also, what you can do from here is then tilt slightly back to the right. You're going to feel that stretch significantly through here. And then when you go to the left this way, then you can also go just straight to the right and push on that left pec and collarbone. Get a good stretch through here. Same thing the other direction as well.
This is a weird device that we also put in your lumbar care kit. It looks like a balance disc. I guess you could use it for that. We don't use it for that. We call it a wobble seat. And the reason we use this is to help hydrate the disc of the lower spine. Dr. John is with me today. He's going to show you how we're going to do that. I'm going to talk you through it. But what I want you to know is if you're a person that sits all day and you have degeneration in the lower back, this is going to be your best friend. Because what it does is helps bring new fluid, healthy new fluid into the disc. If you have degenerative disc disease, arthritis, any of those things in the lower, this is going to be your favorite buddy. What you want to do is you want to put the bumps down on the table or on the chair that you're sitting in. If you're in a leather chair, this has happened, If you're in a leather chair, you do not want to put this directly into the leather chair because it's going to make dimples. They'll come out, but it takes a while. So you like to have a hard surface. Kitchen table works, or if you've got an office chair, you grab a seat for me here. Perfect. So the idea with this is the directions of the disc. And you're going to see Dr. John is going to go, at first, he's going to go side to side. The reason he's going side to side, and you'll see that it's moving at his hip and his pelvis. What we train on, and what you should have been told in the clinic, is that he's thinking about driving into that hip bone and driving this one into the hip bone. It is not a hula dance, okay? Side to side to hydrate the disc, side to side. The other one he's going to do is front to back, but I don't want you to just go front to back. We call that belly in, belly out. He doesn't have much of a belly. What that does is it hydrates the front and the back side of the disc. If you're having a lower back problem, this motion right here is going to be the one that's a little bit uncomfortable. I need you to stick with it because that's pumping the fluid off the nerve in that disc. And this one is going to be the most important one. It is a diagonal. The reason the diagonal is the most important is because 80% of disc herniations happen posterior lateral. If you don't know what that means, it means diagonal. So what he's going to do is show us how you do that. He's going at a vector this way and back and forth, and this way and back and forth. These are the three motions we need to do. So we're going to go side to side, belly in, belly out, and a diagonal. If you'll do these, it hydrates every section around the annulus of the disc, keeping it healthy, decreasing bulges, reducing herniations, all those awesome things from a simple device. Thanks again. This is what's called a foam roller. If you've ever worked out at a gym, you've seen one, you've heard of them. People talk about them all the time. They roll them on every piece of their body. I'm going to tell you, it's not exactly how we like to use them. This will be in your care kit or something very similar. We've gone to something like I like a little smaller for a cervical one. What I want you to do with this is create thoracic mobility. That's the rib cage mobility. I'm going to do that by two ways. One of the ways that I'm going to have you do it is laying on the floor, and since I'm demoing by myself, you're going to lay it on the floor. I want it to go vertically down the spine, vertically, with your head able to arc over. What that does is that it allows for you to open up the pec, stretching the pec muscle, opening and arcing, and also pulling the neck back. If you received a Denerol and a foam roller in your cervical care kit, we probably already know that you have a forward head posture, your head's too far forward. What we're trying to do is reduce the muscular strain on the front side of your body to bring your head back and allow laxity in the muscles. The other one that you want to do is you're going to get a lot of clicks and clacks. You're going to get some pops and snaps. Please don't let that make you nervous at all. It's very, very normal. There are 6 joints per thoracic segment. There are 12 thoracic segments. So if you think about how many joints are in the rib cage, I don't know how the math is, but that's a bunch of joints. You're going to hear a lot of clicks and clacks, okay? Here's the kicker. When you're rolling up and down, just like you've seen at the gym, literally rolling up and down, you never want to get past where your rib cage is not there. In other words, there's no support structure there. So at that point, we're pushing directly on the spine. That's my job. That's not your job. You don't want to do that. We want to make sure that we're dialing that in and we're not causing more problems than we're fixing. So the two big ones for a cervical care kit would be, number one, a vertical lie with your chest open and your head back. Timing like that, honestly, I'm going to leave that one up to you. If you notice numbness and tingling in the arms or hands, get off of it. If it's starting to you get cold in the arms and hands, you need to do it more often, but we need to do shorter time periods. And the other one is up and down the spine. You are always going to get clicks and clacks and pops and snaps out of that, especially if you are under chiropractic care. We want you to know that that's a very normal response. This is a way to free up your thoracic spine, which will allow motion for the neck. Thanks again. So if you're receiving this video, you are on a care plan. Trust us on the care plan. We have a plan of attack. We work the plan, but here's the big part of it is you doing stuff at home while we do stuff in the office. If you remember in the clinic, we said it's the IUE that gets the patient better. I will do my job, or the other doctors will do their job. If you do your job, we will get there together. This is part of your job. So if you're a neck patient and you were a cervical patient, you have neck problems, we probably gave you on your visit, 3rd or 4th visit, one of these devices. What I want you to know is what it's called. It's called a Denerol. It's from a guy in New Zealand whose last name was Denerol. It's not a dinner roll. It is a Denerol. Dennerol. Two different ones. This is a yellow one. It's a pediatric. The white one is a medium for a taller or longer neck. You can see that they're different heights. What we use them for is when you're in our clinic to get adjusted, I unlock the spine. One of the doctors will unlock the spine. That's part of the adjustment. The next part is that we have to stretch the anterior musculature, the muscles in the front of the neck and the ligaments in front of the spine. We use the most clinically effective, the most researched device on the planet are these two devices, believe it or not. So I'm going to instruct you on how to use them and where to use them. This is Madison. She uses a yellow, so I'm going to go through that. It's the same exact instructions for the white one. So with the yellow Denerol, you're going to see where it says shoulders this side. Reason that's important is that that's the side I need your neck, your lower part to be. You're going to place it, if we told you you were a lower neck, you're going to place it in the lower half of your neck. If we told you were middle, obviously put it in the middle or upper cervical. We typically don't do an upper cervical curve change. Most often I'm going to ask for right in the middle of the neck, middle to lower. I'm going to show you what we're going to do. Shoulders this side, flat side down. I'm going to lift her head, place it gently under, relax the head back. If you're in a good, healthy position, you'll see that her head is somewhat neutral, the neck is in curve. The reason we want that to happen is because if you've lost the curve in the neck and we're just adjusting the bones, but we never address the ligaments or we never address the muscular structure, we're not going to get the change we need. So this is a cervical Denerol. You lay on your back, and then in your packet, in your container that you get the Denerol in, there's going to be a chart that shows minutes. Typically, it says to start on 1 minute. I'm going to tell you, I like to start at 3, working up to 20 on a maximum. Here's how I use mine, and yes, I have one at home, and I use it consistently. Mine stays on my nightstand. It's the first thing that I stick under my neck as I'm going through my daily routine. I check emails in the morning, do a little social stuff. I know it's not the greatest, but it's the best time for me to find some quiet time to put that back into my neck. I lean forward all day long. I have to do something in the reverse. This is the cervical Denerol, the most clinically effective device on the planet today to get a curve change. If you'll use this and you'll stick to your care plan, the results are soon to come. So the series we just spoke about was the lumbar care kit. There may be some other devices in there that we'll add in as we go along, but here's what I need you to know. If we gave you the devices, you paid for the devices, there are things we talked about, there's exercises, it's all passive. It's all easy stuff. Over the past 10 years, we've been weeding this down to get what we call the maximum effective dose with the minimum effort on purpose. I get the best compliance out of that. So if you'll do us a favor, you're really doing yourself a favor, stick to this stuff. Please, just once a day. Honestly, I'd be okay if you did it every other day. I just need you to do some of these things that we're asking you to do to change the shape of your pelvis, because what I know for a fact is I get results in the clinic no matter what. But we get results that really matter when the patient's at home doing their stuff and we're at the office doing our stuff. Now we're winning the race together and we get you to the place you want to go. So if you're truly vested, not just financially and just time, be vested all the way. Go 100%, give us a shot at this stuff, put all your effort in, and in the next 6 to 12 weeks, you're going to see some crazy, amazing results that are unheard of in chiropractic. I promise you unheard of in chiropractic, but I got to have you do your part. Dr. Grizz at 918 Chiropractic and Dr. John and Dr. Hunter, we're all going to do our jobs. You do yours. Thanks again.